Okay, so is it tear trough filler or is it cheek filler? So you might see the results of this patient here that we've done. Great result, but actually a lot of people are coming in and the first thing this patient said is, I need my tear trough done. That's not strictly true. What it was is they're bothered about the area underneath their eye. So what we actually need to do is go, well, what is the cause of this? So always looking at the cause rather than just the solution. So the solution isn't just underneath the eye. The cause is actually the elasticity in the skin, and below there is dropping and falling. So actually we're showing there's a loss of volume in the cheek. What we did is we refill part of the front cheek, that apple of the cheek, and actually, which you can't quite see, but I'll show you here, is we refilled slightly higher into the cheek as well, and then placed a small amount of product underneath. To actually achieve this result, what it was is I think it was about 1 ml of product underneath into the apple of the cheek on both sides, and then slightly 0.5 ml into the upper on the patient's right hand side, and then literally it was 0.3 of a fine product under the duoderm of TSL underneath, where we actually fill up that finer part of the area underneath the tear trough, so that we can have it. So a combination of almost like 2 to 3 different treatments: cheek, lateral cheek, then underneath in the tear trough as well. Using total, I think we had 1, 2, 2.5, about 3 mils of product, with 2 different types of product, from the sub-Q density for the cheeks and then the lighter product on top. So remember, when you are doing tear trough treatments for patients who come in saying, I'm bothered about my under eye, is it tear trough or is it actually going to need a combination of treatments from both tear trough and cheek filler?